Hello, I'm Sofia Dorinskaya, a doctor and head of the Center for Medical Information. Today, I will answer the question, why take antibiotics if the body is well nourished, takes vitamins, minerals, and nutrients, and can handle things on its own since it has resources? I want to remind you, we've already discussed this, but I understand that everything has already been forgotten. So, nutrient deficiencies are at the root of all the problems that exist in the body. This is true, and it's at the root of cancer, inflammatory diseases, and the malfunction of the immune system, endocrine system, and gastrointestinal system, all of them. But when secondary pathology developed on the basis of deficiencies, unfortunately, the body has no way to cope with it. That's why we never refuse and we never tell people that it's only about eliminating deficiencies. Forget about doctors. You can't do that. Because when you have vitamin deficiencies, and that's true, and you develop secondary pathology, this secondary pathology should be treated on its own. Sometimes, when nutrient deficiencies are eliminated, for example, when cysts are opened and the cyst is opened, the body finds stagnant inflammation there. It starts to deal with it, and the temperature rises. But if, for example, this is done during a nutrient deficiency elimination program, the temperature never rises to any serious numbers. It stays at a low-grade fever level, up to 38 degrees. Up to 38, no one tries to lower the temperature. No antibiotics are prescribed. Up to 38 degrees, this means that the body is coping perfectly on its own. Yes, that's right. And we have plenty of such examples. But if the inflammation, for example, is already serious and the temperature rises above 38, you should help your body and go to the doctor so that they can prescribe antibiotics for you. If vitamin deficiencies have brought your tissues to the point where development is already taking place there, of undifferentiated cells, and the body no longer knows, it can no longer control these processes. What is oncology? What is cancer? What is its essence? Yes, these are worn-out tissues. As a result of nutrient deficiencies and vitamin deficiencies, which the body tries to patch up, to increase the enzyme, which is the agent that is present in a human embryo, yes, the so-called cancer embryonic antigen, which is embryonic. It's normal in the embryo, but why is it called cancerous in humans? Yes, because an increase already suggests oncology. Why? Yes, because the body is trying to patch up all these tissues, but it no longer has enough strength. It no longer has enough nutrients. Those very ones, the tissues are already deficient. Everything. And a person develops cancer. Then by simply eliminating nutrient deficiencies, you can't turn the machine back. If there is already a tumor, you need to go to oncologists, and they, with their professional protocols and methods, should directly target the tumor. Another thing is that when your treatment cycle is over, you need to eliminate the root cause. You need to address the underlying cause. That's exactly why. Why take antibiotics if the body is nourished? It gets resources, and when the body has the resources to deal with any, so to speak, agent, there is no reason to prescribe antibiotics. And if there is already a reason to get treatment, then you need to go and get treated. You see, you need to go. Because that's considered a secondary pathology in relation to nutrient deficiencies, and it should already be treated as a separate, roughly speaking, pathology. You understand? So don't think that if you have cancer and you start taking vitamin regimens, you can just ignore going to the oncologist. No, you can't. You have to go to them, and you have to follow all their instructions, all the procedures and make sure that the process is stopped and brought into what's called remission. And then, with a clear understanding, of course, you need to keep addressing deficiencies, restoring your tissues so that the situation doesn't happen again. That's all. Systemic candidiasis is common in people who frequently use antibiotics. Who like to take antibiotics, of course. That's an interesting remark. I don't get how anyone enjoys taking pills, but that's how it is. If you are in a situation of constant illness, where you need to take antibiotics all the time, and they don't work, that means you have such severe nutrient deficiencies that these things stop working for you. So it's basically a sign that you really need to address those deficiencies. You see, because antibiotics just don't work anymore. Antibiotics are meant to help with something specific, not just as a general medicine for health. You see, things work a little differently there. So, if you're in this situation, please come for nutrient deficiency correction. We'll sort out your prescriptions. We'll figure out your tons of antibiotics. Why, what for? And we'll help you get out of systemic candidiasis. Thank you for your attention. All the best. Thank you.